Okay, so we're going to dive deep today into AI and healthcare.
Sounds exciting.
It is, it is. We've got this really interesting source material for our deep dive today.
Okay.
It's actually a fictional podcast script.
Interesting.
Yeah, and it kind of paints this super optimistic picture of how AI could be used in medicine.
Right.
So, it's fiction, right?
Yeah.
But it does bring up some really valid points that are worth exploring.
Yeah, I can see that.
Like, what if AI could read your x-rays better than a human could?
Mm.
Or what if AI could predict health risks before you even felt sick?
Oh,
Or,
wow.
even bring quality health care to those remote villages where it's really hard to access right now.
That's a great point.
So that's the kind of potential we're going to be unpacking today.
And what I find really interesting is that even though the script is fictional, it's actually grounded in real advancements that are happening right now.
Right.
And it's also touching on some real challenges that we are facing in the field. So in a way, it's like peeking into a possible future.
Yeah.
A future that might be closer than we think.
Yeah. And like you were saying, this isn't just like some sci-fi fantasy anymore.
Right.
This script talks about AI analyzing images,
Yeah.
like medical images, x-rays, MRIs,
Mm-hmm.
with incredible accuracy, like even sometimes catching things that human doctors might miss.
That's pretty remarkable.
It is. It's almost like having this second set of like superpowered eyes
Right.
looking at your scans.
Exactly. And one of the examples that really stood out to me from the script was the use of AI in dermatology. So imagine, you go to the dermatologist, you have this suspicious mole.
Oh, yeah.
And instead of waiting for a biopsy,
Right.
the AI is able to analyze the image, like right there in the office,
Wow.
and help the doctor determine if it needs further investigation or not.
Okay, so faster diagnosis, faster treatment.
Exactly.
That's huge, especially for something as serious as skin cancer.
Absolutely. And that example really highlights a key theme
Yeah.
that emerges from the script, which is this idea that AI is meant to augment the skills of healthcare professionals,
Okay.
not to replace them.
Gotcha, gotcha.
Hmm.
So it's not about AI taking over the doctor's job.
Not at all.
It's about AI doing that like data-heavy lifting,
Right.
freeing up the doctors to spend more time with their patients,
Exactly.
actually listening to their concerns.
Exactly, precisely. It allows doctors to really focus on those human aspects of care,
Mm-hmm.
which are just as important, if not more important,
Right.
than the technical aspects.
Okay, but that brings up the question of access, right?
Oh, absolutely.
Like, this technology sounds amazing, but is it going to be available to everyone?
That's the big question.
Because, having cutting-edge AI in some fancy hospital doesn't really help someone
Right.
in a remote village who can barely access, basic health care.
Exactly, and that's the equity challenge that the script really highlights.
Yeah.
It talks about AI's potential to actually bridge those healthcare gaps,
Yeah.
especially in underserved communities.
So how would that even work?
Well, imagine AI-powered mobile health apps
Okay.
that can actually screen for various conditions,
Wow.
bringing those diagnostic tools to places where doctors are scarce.
Okay, so theoretically, you could have a community health worker
Yes.
in a remote village using an app to screen for, diabetes or heart disease,
Exactly.
potentially saving lives.
Precisely, that's the idea. But there's a big but here.
Uh-oh.
Without investment in digital infrastructure,
Yeah.
the equity dream kind of falls apart.
So it's not just about developing the AI itself.
Oh.
It's about making sure everyone can actually benefit from it.
It's about access. It's about infrastructure.
Okay, so we need internet access.
Yes.
We need affordable devices.
Absolutely.
We need people to know how to use this technology.
Digital literacy, yeah.
It's a lot.
It is. It's a big undertaking.
So there's definitely a social responsibility component to all of this.
Absolutely.
But let's shift gears for a second
Okay.
and talk about the future.
The future. Let's get futuristic.
Okay, so the script, it paints this picture of AI and human intelligence working together.
Yes.
Like this dynamic duo of healthcare.
I love that. The dynamic duo.
Right. So it's this partnership where AI handles all that number crunching,
Right.
identifying patterns, potential risks,
Mm-hmm.
and then the doctors can focus on the patient interaction,
Right.
the complex decision making, providing that human touch that's so vital in healthcare.
Exactly. It's about, AI taking care of what it does best
Right.
and allowing humans to focus on what they do best. best.
That makes a lot of sense. It's not AI taking over.
Right.
It's AI empowering doctors to do what they do best.
Exactly.
But let's take that a step further.
Okay.
What does this partnership mean for patients?
Well, one area where this could be absolutely transformative is preventative care.
Oh, interesting.
Imagine wearing a device
Okay.
that's constantly monitoring your health,
Mm-hmm.
collecting data on everything.
So like a super smart fitness tracker.
Yeah, exactly. And AI could then analyze all that data
Wow.
and actually alert your doctor to potential issues
Oh, wow.
before you even feel sick.
Hold on. So we're talking about a future where
Yes.
healthcare is less about reacting to illness
Yes,
and more about proactively maintaining health.
precisely.
Mm.
Early intervention, personalized treatments,
Mm-hmm.
potentially even preventing diseases altogether.
Wow.
That's the power of AI-driven preventative care.
That's incredible. But with all this talk about data and algorithms,
Yeah, it's easy to get caught up in the tech
it is.
and forget about the human stories behind it all.
Exactly. And this script talks a lot about AI being this tool for doctors.
Mm-hmm.
But what about AI empowering patients themselves?
Ah, now you're thinking outside the script.
Well, I like to push the boundaries a little bit.
That's a great point.
What if AI could give us more control over our own health? Arm us with knowledge and tools so we can make more informed decisions.
Exactly, instead of just, relying on Dr. Google,
Yeah, exactly.
which we all know can be a bit of a black hole.
A dangerous black hole.
Yeah.
So imagine having this like AI-powered health assistant
Yeah.
that not only tracks all your health data, but also helps you actually interpret it.
Right.
Gives you personalized recommendations, maybe even connects you with resources tailored to your specific needs.
That's a really cool concept.
It is.
Yeah.
But are we talking about replacing doctors with AI apps?
No, not replacing.
Okay.
More like redefining the roles.
Okay.
Think of it as this shift towards empowering individuals
Mm-hmm.
to become more informed and engaged participants in their own healthcare journey.
Okay.
So it's like, having this super knowledgeable sidekick,
Oh, I love that.
helping you navigate all the complex information out there.
The sidekick analogy, I like that. But it brings up another question.
Sure.
We talked earlier about that digital divide.
Right.
What about the folks who don't have access to this technology?
That's critical. Any conversation about AI in healthcare has to address equitable access.
Yeah.
We can't just assume everyone has the latest smartphone or super fast internet.
Right.
Those things aren't a given for everyone.
It's like we need like a two-pronged approach,
Yeah, I agree.
Develop the technology, but then also make sure it actually reaches those who need it most,
Absolutely.
regardless of their income or their location.
Exactly. Investment in digital infrastructure,
Yeah.
community outreach programs,
Mhm.
maybe even subsidized access to AI-powered health tools.
Okay.
These are all pieces of the puzzle.
So we're not just talking about a tech shift.
Yeah.
We're talking about a societal shift.
A societal shift, absolutely.
But even if we figure out that whole access issue,
Right.
there's still this question of trust.
Trust, that's key. You mean, will people be comfortable sharing their personal health information with an AI?
Exactly. Because
Well-
this is sensitive stuff.
It is.
Our medical history, our genetic information, our lifestyle choices.
Absolutely. And that's why transparency and user control are so important.
Mm.
People need to understand how their data is being used.
Okay.
They need to feel confident that it's secure,
Right.
and they need to have the ability to opt out if they choose to.
So it's not just about building some cool app.
No.
It's about building trust with users.
Trust is paramount, and that trust has to be earned.
Right.
People need to see real, tangible benefits
Okay.
from using AI in healthcare.
All right. I'm starting to see how all these pieces fit together.
Yeah, it's complex.
It is. It is.
Yeah.
But you know me, I always have to play devil's advocate for a second.
Go ahead, challenge me.
What if people become too reliant on AI for their health information?
Okay.
I mean, could it lead to less critical thinking or even self-diagnosis gone wrong? We've all been down that rabbit hole on the internet.
That's a valid concern. There's always a risk of over-reliance
Right.
on any technology. AI is no exception.
So how do we prevent that?
I think it comes down to education and digital literacy.
Okay.
People need to be equipped to critically evaluate the information they're getting from AI.
Not just blindly accepting it. Right.
Exactly. Understanding AI's limitations, knowing when to seek professional medical advice,
Right.
and being able to spot misinformation.
It sounds like we're talking about a whole new set of skills that people are going to need.
Absolutely. We need to be prepared for a future where AI is just woven into the fabric of our lives, healthcare included.
So it's not just about the tech itself. It's about how we adapt to it,
Right.
how we use it responsibly.
Responsibility, that's a key word.
It is. Okay, so we've gone from AI reading X-rays
Yeah.
to AI potentially empowering people to take control of their own health.
It's a pretty amazing journey when you think about it.
It is a wild journey, and we're just getting started.
We are. The possibilities are incredible.
They are.
But so are the questions we need to be asking.
Speaking of questions, there's one more thing that's been on my mind.
Okay, I'm listening.
All this talk about AI in healthcare, it's very focused on the technology,
Yeah.
the data, the outcomes.
But you're thinking about the human element.
Yeah, exactly. Like, will AI fundamentally change that doctor-patient relationship?
That's a profound question. And it is something that the source material touches on.
Okay.
You know, this idea of AI freeing up doctors to be more present with their patients.
Right. But could it also make healthcare more impersonal?
It's possible.
You know, like we're just interacting with machines instead of humans.
It's a fascinating paradox. There's definitely that risk, that AI could create this distance between doctors and patients.
With technology acting as the middleman.
Right. But there's also the flip side to consider.
Okay.
What if AI taking over those more routine tasks actually allows doctors to be more empathetic,
Oh, okay.
more attentive?
Interesting.
Because they're not so bogged down by all those other things.
So it's not a given that AI is going to lead to this colder, more clinical healthcare experience.
Not at all. I think it really depends on how we choose to integrate AI into the system.
Okay.
If we prioritize human-centered design, I think AI has the potential to make healthcare more personal.
Okay.
And actually more compassionate.
That's reassuring.
Yeah.
But it makes me realize we're not just talking about algorithms and data here.
Right.
We're talking about the future of human connection.
Absolutely. And that's what makes this conversation so much bigger than just technology.
Right.
It's about our values, our priorities, and what kind of future we want to create for healthcare.
Okay. We have covered so much ground today.
I know. My head is spinning.
We've talked about the potential of AI in healthcare, the importance of equitable access,
Yeah.
the possible impact on the doctor-patient relationship.
And we've raised some pretty big questions, haven't we?
Yeah, we have.
About the role of AI in empowering patients, the need for digital literacy,
Right.
and the responsibility that comes with developing and using this technology.
My brain is officially full.
Mine too. But it's a good full.
It is. It is.
It's about recognizing that AI in healthcare isn't some far-off concept.
Right.
It's happening now,
Yeah.
and it's going to impact all of us in some way.
So what does this all mean for you, the listener?
It means staying informed, asking those tough questions, and making your voice heard.
Because
the future of healthcare is being shaped right now.
Right.
And we all have a role to play in it.
We've talked a lot about the patient side of things, but what about the doctors and nurses and everyone else on the front lines of healthcare?
Right.
How do you think AI is going to change their day-to-day work?
Well, the source material kind of hints at this shift, this idea that AI could handle a lot of those repetitive tasks
Oh, okay.
that often bog down healthcare professionals.
So things like data entry.
Yeah, exactly. Data entry, administrative work, even maybe some preliminary analysis of scans and things like that.
So it frees up their time and mental energy to do other things.
Exactly. It's about freeing up their time and energy so they can actually spend more time with patients.
Instead of being stuck behind a computer screen all day.
Right. Exactly. More time listening, more time explaining treatment options, more time providing that human connection.
Which is so important.
Absolutely. And, that could actually lead to a more fulfilling work experience for healthcare providers.
Okay.
And ultimately, better care for patients.
That's a win-win. But does this mean doctors and nurses are going to have to go back to school? Like, learn a whole new set of AI-related skills?
Well, I think their training will certainly need to adapt. Understanding how these AI systems work, how to interpret the data they produce, knowing their limitations.
Right.
These are going to be crucial skills for healthcare professionals moving forward.
So maybe we'll start seeing AI in Medicine 101 popping up in med schools.
Exactly. And continuing education programs are going to have to keep pace
Yeah.
with these rapid advancements in AI. It's a whole new frontier.
It is new frontier. And, speaking of new frontiers, one thing that always comes to mind with these big technological leaps is cost.
Yeah,
Developing AI isn't cheap.
it's not.
So will all this make healthcare more expensive?
That's a really common concern, and the initial investment can be, pretty significant. But there's also a flip side to this. AI could actually make healthcare more efficient in the long run,
Oh, interesting.
and that could lead to cost savings down the line.
Okay, I see where you're going with this. How so?
Well, think about all the areas where AI could improve efficiency. Automating administrative tasks, reducing the need for some of those expensive tests, helping doctors make faster and more accurate diagnoses,
Right.
even personalizing treatments to ensure better outcomes.
Hmm.
All these things can contribute to lowering costs over time.
So it's not just about that initial price tag.
Right.
It's about the long-term impact on the entire healthcare system.
Exactly. It's a complex equation.
It is.
But one worth considering. Of course, no conversation about technology is really complete without talking about the downsides.
The what ifs.
Yeah, the what ifs, those unforeseen consequences, the uh-oh moments
All right.
when the technology doesn't quite behave as expected.
And those definitely happen.
Oh, they definitely happen. And that's why it's crucial to approach AI in healthcare with caution.
Hmm.
A healthy dose of caution and a constant focus on those ethical considerations.
Yeah.
We need to be asking those tough questions. What could go wrong? How do we mitigate those risks?
Okay.
What safeguards need to be put in place?
It's like we're all on this journey figuring out how to integrate this incredibly powerful technology into something as complex and vital as healthcare.
Exactly. And it's a journey we're all on together. It's not just about the technology itself.
Okay.
It's about the people who develop it, the
Mhm.
people who use it, and the
Yeah.
people who are impacted by it.
So it's a collective responsibility.
It is. It's a collective responsibility to make sure that AI in healthcare is used ethically and for the betterment of humanity.
It is a big responsibility.
Mhm.
And, this whole conversation, it really makes me think about the future. What's healthcare going to look like in, say, 10 years?
That's a great question. I mean, if we look at the trajectory of AI and kind of extrapolate a bit, I think we could see some really amazing things.
Like what? Give us the future forecast.
Well, first of all, I think we'll see AI becoming even more integrated into every aspect of healthcare, from diagnosis to treatment to ongoing monitoring and management. Imagine a world where AI can help doctors identify diseases in their earliest stages,
Wow.
or even predict which patients are most likely to develop certain conditions so we can really focus on prevention.
Okay, so early detection, prevention, that's huge.
Absolutely. And I think we'll see AI driving the rise of personalized medicine.
Personalized medicine, what does that even mean?
Treatments that are tailored to your individual genes, your lifestyle, your specific needs.
So not just like a one-size-fits-all approach anymore.
Exactly. AI can analyze vast amounts of data to figure out what will work best for you as an individual.
Right.
And that could revolutionize how we approach everything from chronic diseases to cancer treatment.
So it's like healthcare that's actually designed for you.
Exactly. And then, there's the potential for AI to completely transform drug discovery.
Oh, interesting.
Right now, it takes years and billions of dollars to develop new drugs.
Isn't that the long process?
It is. But AI could help speed up that process significantly.
Now.
Well, by analyzing data on existing drugs, genetic information, even clinical trial results, AI could help identify promising new drug candidates much faster.
So potentially we could have new treatments for diseases that are currently incurable.
Exactly. And I think we'll see AI playing a bigger role in mental health care, too.
Oh, yeah, that's a good point.
AI-powered apps and chatbots can provide support and therapy to people who might not have access to traditional mental health services.
That's a huge need right now.
It is. It is.
Yeah.
And, we're even seeing AI being used to develop prosthetic limbs that are more responsive and intuitive,
Wow.
helping people regain mobility and independence.
That's incredible. It's like something out of a movie,
It is. It's amazing to think about what's possible. But as we embrace all these incredible possibilities, we also have to be mindful of the challenges.
Right. Like what?
Well, first and foremost, we need to make sure that AI is developed and used ethically.
Okay.
That means addressing issues like bias, privacy, and transparency. We need to ensure that AI systems are fair, that they're not discriminating against certain groups of people,
Right.
and that people have control over their own health data.
So it's not just about building the tech, it's about building it responsibly.
Exactly,
Yeah.
exactly. We also need to figure out how to integrate AI seamlessly into existing healthcare systems.
Yeah, that's not always easy.
It's not. It requires collaboration between tech experts, healthcare providers, policymakers, and, of course, patients themselves.
So it's a team effort.
Yeah, it is.
Yeah.
And then there's the workforce issue. As AI takes on more tasks, we need to think about how that will impact healthcare jobs.
Okay, will AI replace doctors and nurses altogether?
I don't think so.
Okay.
I think it's more likely that AI will augment their role, allowing them to focus on the more complex and human aspects of care.
So maybe they'll need to develop new skills,
Right.
learn to work alongside these AI systems.
Exactly. We need to make sure healthcare professionals are equipped for this AI-powered future.
And then, of course, there's always the question of cost.
Right, making sure these technologies are accessible and affordable for everyone,
Yeah, that's key.
not just for the privileged few.
It's a lot to think about, but it's also incredibly exciting to imagine the possibilities.
It is. We're standing at the cusp of a truly transformative era in healthcare.
So as we wrap up this deep dive into AI and healthcare, what's the one takeaway you want our listeners to leave with?
The future of healthcare is being written right now, and it's a future we all have a stake in. AI has the potential to improve our lives in profound ways,
Yeah.
but it's up to us to make sure it's used responsibly, ethically, and for the benefit of all.
That's a great message to end on. Thanks for joining us for this fascinating deep dive into the world of AI and healthcare. Until next time, stay curious and stay engaged.